Hello, you're watching my YouTube channel, and I'm your host Kamranarshad. Today, I've invited a guest from Abdilo, and I want to discuss her life, her visions, her goals, and most importantly, her field. Hello and welcome. We are delighted to have Anila Khan here today with us. Anila, thank you so much for joining us today.
Thank you so much, Kamran, for having me. And we have been planning this for some time, but finally we got some time to have one-to-one discussion.
That's great. Okay, Anila, first of all, to kick off, could you tell us what inspired you to pursue a career as a clinical psychologist, respiratory trainer, disability rights, Austin, mental health advocacy, and perhaps share a bit about your journey leading up to your current role?
Okay, so that is a very interesting thought because that was totally accidental. So a day before yesterday, I was just thinking about that why I have developed this career, let's say. But I like watching movies actually. So they used to have a movie with the name of X Files. And if you're about X Files, you know that person with the name of the Mulder who was a behavior psychologist. So he used to talk about whenever they will solve a case. Basically, he was a forensic psychologist also. So whenever they will solve a case, they describe the whole personality of that person. So he will say that why this person were criminal and stuff like that. But there's a personality also. His name is we remember him with the name of Big B, Big Brother, and he's in Lahore. Dr. Khalid Jami. So he always used to have shows on Eid, and I used to love those shows. But I never thought that I will become that until accidentally I have to select 2, 3 subjects, and one of them was psychology. I think psychology is better than education. Other subjects are also good, but I think I am always an observant child, observant person, a person who want to know a lot, question a lot of things, because a lot of people who study psychology don't become a clinical psychologist. So that was something like that. But that is, I would say, that is an accidental journey. But I have done a lot of efforts for that also. Like there's a lot of hard work, understanding people, understanding psychology of them, developmental psychology. So that was something like that.
All right, Anila, if we use a social media platform, so we have seen a lot of people, they have right in their profile that clinical psychologist, clinical psychotherapist. Could you please tell me, from my knowledge, because I don't know properly, what is the difference between a psychologist or a psychotherapist?
Psychotherapist is basically a form of a treatment, actually, a treatment modality. Psychotherapists are the people who basically, I am a trained psychotherapist. And psychotherapy is the classical form of therapy that you apply. Now, there are very modern techniques which people are applying. Some of them are working, some of them are not working, some of them are short term, actually. So, let me give you the example of cognitive behavior therapy. A lot of people will say CBT. A lot of people will say they are hypnotherapists. People will say they are NLP. So these are some modern techniques. Some of them work, some of them don't work. But psychologist is somebody who do MSc in psychology. So that person is a psychologist. So if you are a clinical psychologist, you need to have a clinical experience. Clinical experience means you have been working with client, with patient who have depression, who have anxiety, who have developmental delays. Because I am working with child and adult both, I was actually becoming a adult therapist, but somehow I find a job as a child therapist. That was my job. I needed some money to have my specialization.
Where are you working now? In Lahore or Islamabad or any other city?
In Islamabad. But
In Islamabad.
I'm Islamabad.
All right.
But my work is profile is a very international based profile. So I am profile. You can see that.
How long have you been doing this? How long have you been doing this? And how did you get into this?
2011. I'm doing since 2011, and I am working as a therapist the day I give my last exam of my BS psychology. The next day I started working with children with autism, who have ADHD, who have developmental delays. So I have learned a lot of therapies over there too. So that's a journey, because if you want to understand adult, you need to know that what is the development of that person, how that person, and how different is, and what is the need of different age, what is the psychology of different age. So that is helping me a lot. That have been helping me a lot.
All right. As a clinical psychologist and SLT, how do you integrate your expertise in both fields to provide comprehensive care for your clients?
So SLT is basically a speech therapist. So when I was when I was working with children, so I get the idea that what I can do best with them. So there I get the idea that certain children who, like, let's say, who they have autism, or they have developmental delay, and that is affecting their communication. If they don't have communication, it is making them more aggressive, because they are not able to say what they want. So they are not able to express their wants, their needs, their comfort, their discomfort. So this takes the journey to become a therapist. And like I am working with autistic adults, let's say, and I'm working with like other person to like neurodivergent people too. So I get the idea that communication, like language, is not just language. Speaking is not just language. First, it's speaking, language, then communication. So people who have language, but they can have issue in the communication. Communication is like two-way communication, like social communication. So people who have acquired language, who have language skill, who have spoken skill, but issue can come in comprehension, issue can come in how to express themselves. So now this is how I'm integrating myself into that. And like when you work with children, and because people think, because at that time I also used to think that, okay, if autistic children and they don't have speech, because their other functions are working well, but just because of not having speech, you cannot compare them. You cannot say that they have intellectual disability. Children who have intellectual disability, they're different than autistic children. Some of them might be have above level of intelligence, but what is stopping them? That was communication, that was expression, that was written expression, let's say, or maybe verbal expression. So that's what is working with, that's how it's working for me. And I think now what I feel is it's empowerment. Like speaking is empowerment, talking about yourself, expressing your need, expressing your want is empowerment. So that's how I integrated both.
Since I started this interview, I'm keenly observing you. You are very passionate about to help people. Is this your aura?
I think that was something genetic, I would say, because
I'm impressed by the commitment.
You know, sometimes what I say about this is like some people are chosen actually. So this is what I do. Like one way or other way, I am helping people. Like if you just go and you can just type my name, you would see a lot of free resources that I have created. So many free resources, and I'm talking about those free. Now people take those topics and they earn on those topics. Like for example, it's my presentation which I give in the free, just in the form of, I just collected some certain parents, I recorded that and I put that on my YouTube channel. People are taking the same topics and they are making money out of that topic. So sometime maybe you can say that I'm just giving them a earning source also, but they can find that free also. But being an empath, like I'm an empath person, I have empathy for the people. And I think that if you are a therapist, if you're a psychologist, if you're a clinical psychologist, if you're not genuinely an empath person, I don't think so you can be genuine to your work. So being genuine is very important.
Have you ever been to anywhere, any other country for this, for the passion, for your job?
You know, it's more like, you know, my reach is into many countries. For example, I have been working with University of Canada. I did research over there. Now I'm working with Sound of Autism, that is in Arizona. The other organization that I'm working with specifically for gender-based violence, for trauma, that is in UK. And I am representing Pakistan all over the world. Like recently, that was a world conference, autistic world conference. That was that kind of a conference. I represented Pakistan in that. Before that, there was some summit in Minnesota. I represented Pakistan over there. Then there was one in the European Council of Autistic People. So I represent Pakistan over there. So my work is international also, and that is advocacy work. So it's like internationally we divide community for white, brown, and black community. So I'm also advocating for all of them. Yeah, this is something.
That's great. That's great, man. All right, let's move on. Could you share an example of a training program you have developed or conducted related to mental health?
Can you repeat your question? I did not get your question.
Yeah, sure. Actually, I want to ask you, could you share an example of a training program you have developed or conducted related to mental health?
Okay, I have been developing training programs for some time, actually. And like the recent program that I was, like the recent training that was with Bank, that was their branch in Rawalpindi. That was their main branch. And over there, people came from all over Pakistan. There were some internees, and it was about stress management and personality development. So I just combined that because banking sector is a stressful place.
Yeah.
Like you have to meet your target and you have to do a lot of things. So
banking and
how
judiciary,
you can work,
they are in stress right now.
Yeah, they are. And then how to build your personality, because sometimes you have a passive personality, you are an introvert, so people would ask you become an extrovert. Sometimes you cannot change your personality, but you can or you can attain certain skills. So it was all about that. Then there was some training I just recently also on mental health of people who have been like there was women actually, and that was about menstrual hygiene, like their hygiene and the COVID time period, and then we have floods. So that was all about that. So these are some two recent trainings that I'm talking about right now. Then I'm also giving on gender-based violence. One of them was today also. So that was an international training of my training, and you can say that why how mental health and physical health can combine together. Like without mental health, you cannot have a good physical health, and both are important. So these are some recent examples, like very recent thing that I did actually.
Actually, we just take care of your physical health. If we find ourselves that we are getting weak, so we go to the gym, we take shakes, we take multivitamins, that we are getting low. But we don't care about our mental health, because there is a dilemma of in our society, ma'am. If someone is finding himself that he has some mental issue, so he's not been able to come to the doctor and says that I have a mental issue, because everyone call him that you are mental. It's a dilemma of a society. Yeah, exactly. So did you ever face this kind of situation, or how to deal with that?
People have to understand one thing, that like I've given one interview yesterday, and it was a very interesting interview for me also, because in that interview I get to know, because first I used to thought, okay, I'm from KP, so I'm Pakhtun and I'm just working for them, and then I get this idea that, like, sometimes you just get this thought in your mind that no, we have Pakhtun in Balochistan also, we have Pakhtun in Afghanistan also. So it's a great language. A lot of people are Pakhtun. So if you're doing something in Pashto language, so you are serving all of them. And the idea of understanding of mental health, because I talk about a very important aspect, that somehow male can get that, but female are not able to get that, because economics is attached to the male. So everybody would go to the doctor, and they will go to the hospital, they will go to the mental health facilities, and some people are and it's a dilemma. People came to us at the end, they visited everybody in this world, like
actually,
every
we have
kind
a
of
fear, ma'am. We have a fear. If someone has a mental issue, he will not come to you and says that I have a mental issue, because everyone called him. People used to say, you have become a mental person, and it's this statement discouraging. And definitely,
because
he will find himself that he is a mental person. These are the things we have to address, but no one is doing that.
Because we don't even understand the meaning of mental health. And if you allow me, I will describe in 3-4 points how you can understand your own mental health. Or maybe if you have this question in your mind, before even asking you, I can give you this idea, because and also you give this idea, ask me other question about food, actually, that food that you're eating. Do you even have the idea, in many mental health conditions, people cannot even eat, they cannot even sleep. And people are asked to sleep well, to eat well. How you can do that when your mind is suffering badly? And it is the dilemma that literally people just want to escape from themselves. I'm not talking about the people, they escape from themselves.
Yeah, actually, this is a question I want to talk about. You are absolutely right, ma'am. This is the issue.
This is the issue. So we have to identify for personal life, like you're waking up, you're sleeping, and your food, eating, sleep, wake, going for the job. Personal life, family life, like your relationship with your family, your educational life, like how well you're performing in the school, and your occupational life, like your job. if those areas are suffering, it means that you have to consult a psychologist. So I just give you a very small, portion of that, because I know we have limited time and we have to, squeeze everything into that limited time. And I know that the more you talk about, more is less. In this case, more is less. But I think we just need to move on to the next question.
All right. I've heard about the statement that a man is known by the company he keeps. So company matters for the person who has a mental issue.
Oh, it meant a lot. And recently I have been, you could say that, talking about that lately a lot. Even there's a thing people call ke, sorry, I'm using word in Urdu, bolne se kya ilaj hota hai, like how a talk therapy can help you, like how you can help somebody when somebody's talking to you. Like with psychologists, this talking is attached to that. Now tell me one thing. And my client told me those things. Ma'am, if this is his words, ma'am, if I get trauma from the way that people deal me, the way that people were name calling me, then there's one thing that they asked me. There was the thing that they were putting me on, like they were blaming. So all was words that was talk, and just because of that, I suffered my whole life. I don't want to this animal. I don't want to meet those people. I don't even want to talk to my family anymore. This dilemma is attached to people. Like you said, that the company that you keep. We have friends and we have friends for our whole life, but sometimes you would see that they're making fun of us. They're body shaming us. They're making the fun of the way we talk. They're making the fun of the way we look. They're making the fun of the way even we apply kajal, let's say, because, okay, I'm female, the way that I'm applying eyeliner, they would have issue with that.
Ma'am, actually, why we have become very judgmental? What do you think? Why we have become very judgmental? Why we judge people?
The judgment is people, because the comparison is happening as a whole. Like we are comparing ourselves with other people. Parents are comparing their children with other people. So this perfectionism, when the moment this perfectionism came in every field, like I want to do the best. And like when society instilled the idea of you competing for the best in education, best in job, we are the best, we are providing best, which is not best. You have this experience, you might have this experience also. So the competition, the comparison, having best in life, having best mobile phone, having best cosmetic, having best, branded means, the expensive brand is the best. So that is instilled, actually, that has been instilled by corporate sector, you could say that. And that is the thing. And like you were just saying that about the company you keep, every day it is, they are killing you. They're killing you by your words. And when they are doing that, what they are doing, they're basically killing your self-image, your confidence. Just because of that, in the company that you keep, that is going to destroy your confidence. That is going to destroy you, actually. So be careful with the company that you keep.
Fair enough. Let's move on. How do you approach advocacy for disability rights and mental health within your community or professional practice, ma'am?
That's a very strange thing about that. I actually learned the advocacy part. And like, how could you advocate for them? And I have to learn that part. And I have to learn that part by going to different people who are advocating, different communities. And like we as Pakistani, we as brown community, we are looking toward, the other countries, the first world countries, that how they're advocating, how they're talking about it, and can you imagine that I have to learn the language, that how to address certain topics.
You are talking about the sign language, am I right?
No, language. Okay. I'm talking about the verbal expression.
Okay.
That how I address this topic, for example, if you're talking about disability, what we can say, what we cannot say. If you're talking about certain disorders, what we can say, what we cannot say, and how we can approach it, how we use our neutral language that is going to, which might not be aggressive, but the message need to be very, you could say that effective message. So I have to learn those things. And then when I just came to, first my exposure was international, and I came to my own country, that about how can I do those things in my country. And then I have to start learning from zero that what is happening in my country. And I have to conduct different discussion with different people. And that was a big difference in our country as the thing that is happening in those countries that is different. And there's another part in that also, because I just don't mention those things with myself. I used to be a social activist. I was very active in social activism part, doing protests and things like that. Then I also did a lot of work with human rights, and then I moved my attention toward disability rights, because a lot of people are there who are working. I think my need is over here.
And you're very,
To
it's a
talk about.
lighter question. On a lighter mode, I want to ask you, I don't know, you will guide me or not. What do you eat or drink? Actually, you're very energetic. I'm enjoying and I'm learning some new things from your side. I am getting some positive vibes from your side.
I still have my coffee over here.
And I'm
But
not
I used to
buttering.
keep myself active.
I'm not buttering. Actually, the thing is, you are very energetic. The thing I've done a lot of interviews with different people from different fields, right? You can watch on my YouTube channel. I've done mostly 50 to 55 interviews, right, so far, and I'm taking your interview. But I am getting positive vibes from your side during this interview. So I would like to mention that. Everyone
Genuine,
don't
actually.
like
I
that.
told you in the start.
Sorry?
I told you in the start, you need to be very genuine, the work that you are doing. You need to be honest to your work. And this is what I'm trying to do. Enjoy the work also. You need to be very genuine when you're doing that work.
Right?
Like, yeah, as a person, you need to be very genuine. Like, you cannot pretend to be an empath. You cannot pretend to be a good person. Like,
we don't need to pretend what we are not.
Yeah. You don't need to pretend that. If you're pretending, your client will get that. They will get that energy from you. And the other thing is also that we are living in a very sad generation. You know, this generation is very sad from very aspect. Plus the trauma that we are getting from everything. So giving something to other people, you know, that is something that is oxygen, let's say, for me. Helping other people, that is oxygen for me. And also, when I get the result when I'm working, that is my oxygen. But as a whole, I would say that energy, I have energy, but I utilize my energy very well. You could say that.
If you find yourself,
I know where to put my energy and where not.
If you find yourself in stress, how do you manage that? You go to the gym, you go for a walk,
I would do,
or you just take a cup of coffee.
I do.
What do you do?
If I'm not feeling, if I don't do exercise, my body.
Sorry, I didn't get you. What you do?
Say that it starts
when you find yourself in stress.
I do exercise.
Exercise, all right.
When I find myself in it, and also I have places where I can take some coaching. I do that also. I take some help for that also. Also, I watch the things that I love to do. You know, like either it's movie, either it's music. So this is what I do actually. And but I would also like to see that where the stress is coming from. So
you come to Lahore or just live in Islamabad?
I live in Islamabad actually. I'm Islamabad based.
You have clients in Lahore, right?
I have clients in all over the world actually.
And I want to be your client as well.
That is another. I have a lot of clients. I have clients in Lahore. I have clients in Dubai, Saudi, UK. I have a lot of clients over here.
I want to be your client as well from Lahore.
It's your choice because you know, people used to think about taking some kind of help, but if client is not willing, and if client is not willing to work on themselves, I think that person is wasting their money, because
actually, that would be a guideline in this society. You can imagine that there are a lot of people who say that they are the doctor, who says that they are the psychologists. So they just listen them and guide them through the book. They don't have any experience for that. A person who has a stress, if he comes to you, he wants some meditation from your side, that you have to listen in properly. You need to address only that point why he's asking. Well, we have started that you have this problem, you have this problem, you have this problem. Then he got fed up and says, "Yaar, paise aaya, I wasted my money." You know. So these things are happening in this society.
You know, I'm angry on my people from my field. And the reason for that is, I don't know what, and sometimes they will put religion in that, sometimes they will put, because people are getting a lot of judgment also.
Yeah. Ma'am, how
And
can we get
have
out from judgments?
seen very worse scenarios. Uh,
Ma'am, how can we get out from judgments?
the judgment is
Actually, if a girl comes in front of us, she comes to us and
let
she
me tell you
wears
something.
pants. So we used to make a compliment that she is a modern. She has some friends because she wears a pants. If a girl comes with a abaya or a hijab, so people used to say she's a very noble girl. Even they didn't speak to her, even a single word to her, that they don't know her name as well, but they make a compliment. They judge that. How can we get out from this? I think this is the problem.
The thing is that you cannot stop. I just heard this in one meeting, and this is like life lesson for me. And this is such an eye-opening thing. People were not happy with profits. They were not. That how much problem our own prophet have faced. Like in his own life. And if you look toward the history, so if they are not happy with that, they are not getting like they will not be happy with us. So the point is that why we are doing something, we have to start looking to ourselves. And also how much if you are in a lot of judgment space, because people do that, and you are in people will judge you. The point is what you think about yourself, that is more important over here. So if they say that, for example, judge and point over the way that I speak, specifically my speed, and I mentioned that, and people said, oh, somebody would say this to you. Yes, even still, sometimes what they do. So they will give me so many things and do this, and learn this. And psychologist, if you speak so fast, how you can be a speech therapist if you speak so fast. The point is difficult, but the point is how I'm going to take out myself from that, because they are not going to define my life. They don't know my heart. So focus on your work, and if people are judging you, leave that company. Like instead you ask how this is how your company is affecting you. I mean, maybe for some time sitting alone is better than people pointing arrow toward you. Yeah. Even if they're 15 or 20 old friends.
Agreed.
They don't have a right to judge.
They will create a problem for you. They will create difficulties for you to getting your goal. You are absolutely right.
And they're just distracting you. So boundaries, that is going to help you out to surpass those judgment actually.
All right. That's great. Ma'am, as an advocate for mental health and disability rights, what are some key challenges you have encountered, and how have you worked to overcome them to promote awareness and changes?
Okay. So I think my social media journey started because of the problem that I have seen. One thing which I have a big problem with people is they are not telling the truth. Like, for example, I have seen people making money out of disability. I have seen people making money out of patients. So if you diagnose somebody, like let me talk about children, and the child have certain kind of disability, a certain kind of challenge, tell this to parents and tell that this is right or not, or how you can work with that. And this is a life condition and things like that. So when you communicate this, maybe parent would, angry on you. They get angry on you. They get angry on me also. They used to get angry on me back then also. But you're telling them the truth, and this truth is going to save them. So if they want to stay, they will stay. If they don't want to stay, they will not stay. So don't lie to parents to keep that client. People do, and I have seen this has been some time, and they don't tell what is reality of some disorders. What is reality? They would say we are going to do this and do this. This condition will just go away, which is a, let's say, developmental condition. So people need to stay real. First thing. Second thing, parents have to also play a role in. And if you talk about a person have to play a role in that, family have to play a role in that. So this is the second challenge. The third challenge is awareness as a whole in the society. And also, people are not aware of so many things. Like still diagnosis challenge. People say that we have a lot of, we have schools, we have special needs, we have a lot of psychologists who are graduating, who are doing therapy and things like that, but even then we still need to talk about what actual mental health is. And please get the difference between a motivational speaker and mental health professional.
They are creating mental health patients, the motivational speakers. They actually talk about that this is the earth, this is the sky, and you are here, you can go there. These are the stories actually. So these the stories they are quoting, it's not actually.
A lot is actually.
Yeah, man.
Yeah. And the thing is that you can talk a lot, you can talk very good, you can make a very good speech. That is not difficult. Even if you could say that this interview is very extempore. I did not get any, I was not, you could say that I did not need preparation for that. But if I'm going to talk on the new topic, I will do preparation for that. But why I'm able to do that? Because I want people to understand that psychology is, mental health is a daily life struggle. And everybody in this world can have those issues, have those problems. When there is emotions, when there is learning, when there are experiences, when there are childhood, when there are relationships, all the issue would come in mental health. The second thing is that, we're talking about the speaker things and the counseling part, and maybe everybody's a therapist around nowadays. People think that, and some people want to listen to lie. So our therapists sometimes do that. Maybe not our therapist. The therapists do that. The motivational speaker do that. The counselor do that. And the parents get happy in that moment. Ask, oh, our therapist said this. He's going to do this. For example, if somebody is an intellectually disabled person and his body is weak, and I remember that example always, with physical challenge, how can you say that this child is going to run in 1 year? And this is what they said this to that client. So be real to people, don't talk to them, and also skills are important. People don't study. People are not studying about anything. Please do that. Update your skills. About whatever you're doing right now. Kind of experiences that you have. So
lovely advice
this is what
given to us, man.
Thank you.
Ms. Anita, thank you so much for joining us today. It was a wonderful having you here and learning from your experiences. But before we wrap up, is there anything you would like to share with our audience, or any message you would like to share?
The message I would like to share is, I think if somebody have a flu, the whole office is empathizing with that person. Oh, you have flu? Did you eat this? Did you eat this? You might have this experience also. But if somebody would say I have depression, and you just give that judgmental look, I'm feeling low. Oh, you might have not eaten something. Don't do that. Mental health is, I would say, more important. It is important, but more important than physical health. And give more priority to your mental health also, because it is interlinked. You have to understand that there's a link between your brain and body, and that is your mental health. I think mental health is something that is, if you're feeling good, you will do good thing in your life. And also I would like to say one thing to people: please have goals in your life. Goals are very important. This is happening with a lot of future youth nowadays. They don't see any future because they don't have any goals in their life. Make some goals, and that is going to help you out to go through a lot of situations. So this is what I would like to say. And thank you so much for having me today. And it was amazing talking to you.
Thank you so much once again. Have a blessed day, man. Take care. Allah Hafiz.